Hello, and welcome to another episode of The Switch. My name is Patty Hampton, and I am excited about this week's topic. Did you know that the nonprofit HR brand ecosystem has exclusively focused on the talent management needs of the social sector, including nonprofits and social enterprises for more than 20 years? This episode is all about grief, trauma, and depression during a crisis, how it shows up, and how to manage it. Listen in as Lisa Brown Alexander, President and CEO with Nonprofit HR, Lisa Dinhofer, the Crisis Tamer at Koden Consulting Services, and Dr. Christine Allen, Workplace Psychologist and Executive Coach with Insight Business Work, share insights into how HR and organizational leaders can help employees cope during crisis, including how to better manage related performance issues, recommend helpful resources, and help build resilience in staff. Share this production in your communities. Download the slides and transcripts by visiting nonprofithr.com/the switch for recording, presentation, and other assets. Without further ado, here's Lisa, and Dr. Allen.
I am thrilled to welcome to this very important discussion two distinguished women, Dr. Christine Allen and Lisa Dinhofer. I just invite them to join us on camera as we get into this very important discussion. As many of you know, Nonprofit HR has spent the last 6 weeks delving into all of the varying aspects of this COVID-19 crisis as it impacts social sector organizations. And so this conversation is particularly important because it deals with the emotional health of our workforces.
This event was originally recorded as a Nonprofit HR webinar. Check out other Nonprofit HR events and virtual learning opportunities at nonprofithr.com/events.
And so what I'd like to do is just delve right in and ask this question of both Dr. Christine Allen and Lisa Dinhofer about a little bit about their backgrounds as it relates to mental health in the workplace. If you just take a quick moment to just tell us your experience in this space to set the stage for today's conversation. Christine?
Thanks, Lisa. Yeah, so my background is as a clinical psychologist who worked in hospitals and in private practice, did some teaching and research for about 20 years. And in that area, I did specialize particularly in helping people with trauma-related issues, post-traumatic stress disorder, but as well as treated people with anxiety and depression and other kinds of mental health issues. But I began to see that I could have greater value in the workplace because really only about 4% of people ever seek out counseling when all of us need some help now and then. And so as an executive coach, I could go into workplaces and work with the leaders, work with their teams. And when you impact the leader and you impact the team, you help the families at home, you help everybody. And so that's really what I've been doing for the last 10 to 15 years of my career. And I think at times like these, well, this is an unprecedented time, but it's a particularly valuable time to have somebody who has expertise both in leadership development and teamwork, but also in mental health in the workplace.
Excellent. Thank you so much. Lisa?
Good morning. Thank you for having me. I'm very excited to be here today. So my background involves a lot of trauma, not me experiencing the trauma necessarily, but being in very traumatic environments. As you read, I was working in the World Trade Center on the 79th floor when it was bombed in '93. And that was my first exposure to trauma in the workplace. And it served, unfortunately, but also fortunately, as a tutorial of what not to do in terms of leadership. And I am convinced today that because of the way my leadership handled it at that time, I'm convinced it led to their eventual demise. The company no longer exists, right? What I saw, how employees were handled, how they were spoken to, it really stayed with me. And again, I was still working in New York City during 9/11, that bombing. And again, that's a pretty stark tutorial on what to do and not to do. I've spent 2 decades working in a very specialized area of healthcare that has a high mortality rate. So I'm used to working within environments that are nonstop crisis. right? And working with a lot of industries that involve first response, nonstop crisis, the exposure to a lot of trauma and death in their work as professionals. So I, like Christine, figured out a long time ago that if I could help teach people in leadership positions as well as on the ground how to manage the exposure to trauma and chronic stress in the course of their job, they would be a lot more productive. Companies would retain their key talent a lot longer, and we would all be a lot more healthy. So that's kind of my background in a nutshell.
I appreciate it, and I thank both of you for being here today. Let's talk a little bit about, as HR leaders and as organizational leaders, we are not only dealing with our external stakeholders, but internal stakeholders, meaning our staff and sometimes our boards. But what are some of the signs that reveal that maybe an employee is coping with some challenges or not necessarily coping well with challenges? What are some of the signs that one might see as a leader, as an HR professional, that might be a red flag? Christine, do you want to tackle that one?
Yeah, I will say to begin with is that I just want to normalize, and I'm sure Lisa D, because you're both Lisas, is on the same page with this. That first of all, to just normalize that this is part of the challenge, is that everyone, managers and leaders and their employees and their families, are all going through something. We might not be going through identical things, but we're all going through something. And to feel anxious and stressed and sad is 100% normal. So how do you then figure out which of your employees might be more vulnerable and maybe need something more or different? But everybody needs something, and everyone needs to sort of rethink and retool what are our coping strategies, because this is, evolution has prepared us to be anxious and stressed in these situations. So we remember to wash our hands. So we are willing to just physically distance. I don't like the social distancing term. I like physical distancing. We wear our mask. So the question becomes, how do we meet the needs of ourselves, self-care? How do we meet the needs of our employees that are feeling stressed and anxious that are normal? And then how do we, like you're saying, Lisa A., figure out who are the vulnerable people that might need something more? And I would just say it's particularly challenging to do that virtually when we're not in the same place. So how do we as managers and leaders dial in and connect with employees and notice who might be feeling, the sadness? And I know Lisa has a lot of expertise, Lisa D has a lot of expertise in this, the difference between normal grief and depression. But how do we figure out when the person is feeling hopeless and like there's no point to getting out of bed? So those are some of my thoughts. Yeah.
What should we look for? What are some physical triggers? And Lisa, you can answer this too, that might tell us that someone is in distress or maybe not coping with this new normal level of stress in a way that is okay, right? That might be concerning. What are some triggers? What should HR leaders and organizational leaders look for or be aware of that when they see this might be a sign that somebody needs some additional support?
I would say the first thing to notice is a real change in someone's behavior. These people, you've been exposed to them, even if you don't know them on an intimate level or for very long, you know what they're like on an everyday way. If you're noticing significant changes in their behavior, their appearance, and significant changes can mean anything from being, super hyper to very withdrawn. If you're noticing changes in how they look to you, if they're not making eye contact, if the tenor of their voice has changed, those are subtle but important cues that something's going on there. And in this time, I think everybody is confused about what should I do or not do? Is it too much, not too much? And I think something that people in leadership need to understand when something like this has happened, and I say these things also like after an active shooter, what's the normal response to the experience you're having? Right? So there's not an easy answer to that, and people are going to respond differently. But to not wait for people to come to you and say, I need help, to go to them and say, hey, I'm noticing this and that about you, what's happening. If we only offer assistance that people have to access themselves, a lot of times they won't.
Right. And I would
Okay,
just chime
that's
in
fair.
with that is asking, and that's sort of what Lisa's saying is that a manager or a leader can reach out by, not just in really formal ways through our regular meetings or check-ins, but really asking employees, directly how they're doing. And if you have concerns about somebody, there's a lot of data and evidence that's saying asking people if they're thinking about harming themselves or hurting themselves, this does not put ideas in people's head. It does not increase the risk of suicide or harm or violence. So, and I think a lot of leaders and managers feel uncomfortable asking those questions. But if, like Lisa's saying, there's some of those signs you see that really worry you about someone, it's okay to ask, are you safe? Are you thinking of hurting yourself?
Yeah.
I just like to bring up what Christine said. I really, agree with what she said. And so one of the resources that I provided that's going to be on the website is the Columbia Suicide Severity Rating Scale. And the version that I've offered is for family and friends, for the lay public. It's 6 questions that you don't need to be a professional, that you can ask somebody, and it gives you a scoring guide at the bottom to know if somebody is really, thinking about harming themselves and in danger. So I really advise HR people and people in leadership positions to just keep that severity rating scale tucked in their drawer. It's just 6 questions. It's extremely effective.
Yeah, I think one of the things that sometimes gets missed in this conversation, we assume that the people asking the questions are comfortable. And sometimes as HR leaders in particular, we know kind of the emotional intelligence quotient of our leadership team. And it can be that that this is not an area where either someone feels comfortable or they can be effective. And I think it's okay for us as HR folks to say, you know what, let me have this conversation on your behalf. But if you see something that's concerning, let me know. If you, as the leader, the supervisor, the manager, is maybe not adept to having kind of emotionally sensitive conversations, I just want to point that out, because sometimes we expect leaders to just naturally be able to have those dial-in conversations, and they're really not comfortable doing that.
Can I make one comment about that, Lisa? Just sort of saying that that's the job of those upper level managers, to coach those frontline managers, about, and the frontline manager is the most important, the most connected for the employee to feel like you care about me as a person. All the Gallup data suggests that, do you value me as a person? And so I think that's a great role for those more senior leaders to try to coach and support those frontline managers. In real, when you're in the office, you can do what's called a warm handoff, to make sure someone follows up with someone, whereas it's, not just giving someone a number to call, but it's a little more complicated to figure out what a warm handoff looks like for me to help someone get connected. So I think you make a really good point, Lisa A., about how to do that.
You have been listening to The Switch, a nonprofit HR podcast on powering your people with talent management insights, best practices, and hacks. Looking for a thought partner to help you integrate talent into your mission's strategic plan? Well, the good news is Nonprofit HR has solutions to meet your unique talent management needs. Strategic planning is an annual ritual for many nonprofits. Yet, countless organizations plan for programs and fundraising without thinking about the talent needed to meet those goals and ultimately their mission. With more than 20 years of expertise under our belt and the bench strength of credentialed consultants, we partner with all mission types and offer solutions that span project-based human resources consulting and outsourcing, search, total rewards, and DEI. Join the community of social impact organizations that have trusted nonprofit HR to help them achieve their full potential through their people.
All right, let's talk a little bit about helping employees face the loss of a loved one. The longer this crisis goes on for, the more likely it is that death will come closer to, or loss will come closer to our staff. So as organizations have employees who face or experience the loss of a loved one, or maybe your organization might even lose an employee to COVID-19, what do you recommend to help organizations and employees deal with those kinds of losses? What should leaders say? What should HR folks say? What's the approach an organization should take if there's been a physical loss, either by a staff person or a family member of a staff person?
So we know from a recent study done by Cigna Health that fear is a major issue for people in the workforce. Fear of a family member becoming ill, fear of themselves becoming ill, and fear of dying from this, and fear of family dying from this. And those fears are very realistic. So in terms of when there's been an actual physical death of an employee, it's critical that you create community around that immediately, right? There needs to be real connection and community building around that. And I would say do the same kinds of things you would do if everyone was on site, and that's to have debriefing. Right? Debriefing, come in and help people with that. If it's the death of a family member of an employee, now more than ever, I think is a time for companies to really look seriously at their bereavement policies. It's been my experience for many years that most bereavement policies serve the company, not the employee. And they cause more harm than good. So I would have somebody really looking at those bereavement policies and ask, do we really want to be in the business of dictating to an employee how much time they should have for dealing with the grief and loss of a loved one? Because the typical 3 days for certain types of relationships and 1 day for their is wholly inadequate and does far more harm than good. But in terms of actual death in the workplace, I would do debriefing. I would speak openly about this. I would make those debriefings mandatory. I get sent out by EPs to do debriefings all the time. And one of the reasons why they're not helpful for companies is because leadership doesn't make attendance to the debriefing mandatory, and it should be. And they should also be participating. And they need to talk about, senior leadership needs to talk about how this has impacted them. Right? So they make it okay for other people to be impacted and to talk about it. So it's all about community.
So Lisa, in a smaller organization of 50 people or even 25, that's really feasible. What do you say to the organization of 500 or 5,000 or nationally dispersed organization where they experience, either a loss of a staff member or the staff member's family member passes away? What would you recommend in that case? Because we've got a really broad diversity of organizations on this call, and some are very small. And so facilitating that debriefing conversation is much easier. In other cases, they've got multiple locations, multiple states, and in this virtual environment may not necessarily be equipped to convene a large national call. So what advice would you give them in that situation?
I would look at delivering these types of resources in cohorts. And the first cohort are the people who were closest to that employee who died. And then you start having more and more sessions wider out to cohorts that are impacted. Just because you don't necessarily know the person well who died, it doesn't mean you're not impacted. So it's not just a one-shot, one size fits all. You have to look at your organization, look at who's being impacted, and start with the closest people, that cohort of people, and then begin having other debriefings or services to those people impacted as you move out. The company should know that somebody in their family, whether it's a 25-person family or a 5,000-person family, died. That people should be made aware of that so that they now are empowered to reach out to maybe the family or to other people and, talk about that. It's how you create community.
Right.
Yeah, two things about what Lisa said that I just want to underscore, and I really think everything she said is like spot on. Just those two pieces about community, what we know about trauma and about coping with trauma is that it is made bearable or easier through support, through social support. And social support is complicated at this time. People can't be with people even when they're in the hospital or sick or dying. But when we hold up, like if you had a concrete slab and we were all trying to hold it up together, we can hold up a lot more weight than I as an individual can hold. So that's one of the things we find that mitigates the impact of trauma, is that kind of community and support Lisa's talking about. And then the second thing is that modeling the way of the leadership. If leadership doesn't attend these events, if they don't show up for these community moments or services as well as debriefs, that speaks volumes to the people of the company, and I think it does harm.
Absolutely. All right, let's move to the next question. So we talked about death in this case, but what about the trauma and the loss that people might feel as a result of having really high levels of uncertainty? How do you recommend that we help our staff navigate through the anxiety and the fear, to use your word, Lisa, that comes from not knowing the future of the organization, its stability, or the communities that you might be serving, or just some sort of significant loss of some sort that is not death related, but a loss that creates uncertainty nonetheless? Any advice from either of you on that front?
Well, I think it's a great question, and I think it's that loss of normalcy that we're all going through in one way or another. And so what I've noticed, and other people have talked about this too, is this notion of sort of comparing suffering to others. I hear this from my coaching clients and people that I know personally, like, oh, well, I should just be grateful because I have a job and I'm not, financially strapped, or, various things people are saying. I think one of the things we have to do with uncertainty is make room for all of our feelings, and that our feelings are going to shift and change. And it's not like you have to get rid of anxiety or fear or sadness in order to experience gratitude, or to experience, love in your family of the person whom you might be able to go for a walk with because you live with that person. So not a polarity, either or. And I often say that, kind of, and others have said this, compassion for ourselves, it's not a finite resource, that if we have self-compassion, that somehow we don't have enough compassion for others. And it's not like pie, that there's a certain number of slices. So the research actually shows that when we're more self-compassionate, we have a bigger heart and bigger love and compassion for others.
Thank you, Christine. Lisa, anything you wanted to add to that?
Yeah, so this is where, the role of educating about grief and loss comes into play, and providing education. When leadership provides education to its workforce, rather not just, psychological support in terms of EAP or counseling, but actual education, it helps people understand what they're experiencing and normalizing it. And what we are all going through now collectively, we're going through collective grief, and we're going through a very particular type of loss known as a non-finite or a non-death loss. And people are often surprised that we grieve losses that don't involve physical death. But we are smack dab in the middle of a non-finite loss that's characterized by the loss is continuous. It starts with an event, but it is continuous with seemingly no end in sight. It creates a lot of uncertainty, powerlessness, helplessness. There's a disconnection from the mainstream. Even though we're connected virtually, we still feel disconnected. There are multiple losses involved within a non-finite loss. It requires constant adjustment, right? To as we go through. The biggest thing about a non-finite loss is that it creates both a coping and a support fatigue. The longer it goes on, and because we are all in this right now, we're suffering this collectively, we're all suffering that support fatigue and the coping fatigue that goes with this. So it's not imagined, it's very real. There are a constellation of grief responses to this non-finite loss, and it's going to be here for a while. And the more senior leadership can understand this and help educate its workforce and provide education around how to manage this, the better the psychologically well-being the leadership will have in their company.
You're listening to The Switch. Follow along with this podcast. Download the slides and other visual materials at nonprofithr.com/The Switch.
That's a really good way for us to segue to leadership's response. And so help those of us who are on the call today, help us understand what you think employees are looking for from their leaders during this time and how leaders can support the emotional well-being of staff, right? We talk a lot about those who are on the receiving end of grief and loss, but what should leadership be doing right now to demonstrate that they care? And what do you think that staff are looking for, employees are looking for from their leaders during this time of uncertainty?
Well, I would say they're looking for a lot of things, but I'd say honesty, authenticity and honesty. So being willing to say how they're impacted in a general way. It doesn't mean that as a leader or a manager, you should be leaning on your employees to, help take care of you or support you, but honesty about this is scary or this is stressful or how it's being real, being human. I would also say they want people to tell the truth, so realistic, be realistic about what the future looks like, even in terms of the work, or certainly there are employees I've worked with where they know they're going to get paid for another month, but they don't know if they'll have money after that. But so be honest and tell the truth. I think empathy and compassion, and that can, that means leaning in a little bit more and acknowledging that they know that people are they're suffering, and an effective leader can do that, convey caring and emotion that shows heart and understanding what people are going through. I think if employees have to take pay cuts, then leadership should have to take pay cuts in some kind of, commensurate way, so they're not the only ones, so that they demonstrate that they're, part of the whole and everyone's being impacted. So those are just a couple of thoughts. There are probably others.
Thanks, Christine. Lisa?
Yeah, I think right now what is key for leadership to understand in preserving the psychological well-being of their workforce is all through their communication style and how they're doing that. And a real masterclass on that is looking at Jacinda Ardern, who is the Prime Minister of New Zealand. She has really epitomized the three principles of really effective leadership communication, and that's clear communication, clear direction giving, meaning making, and empathy in how she communicates. And it's why she had such a high level of compliance and why her country is doing so well. I think it's mission critical for leaders to be willing to be vulnerable and demonstrate humility in front of their staff in terms of saying, this has impacted me too. And as an example, the leaders that I've worked with who've gone through an active shooting, they often get really ill-advised advice about you can't show that you've been impacted, you can't tell people you're getting help, it will weaken you as a leader. And I've told them that's the worst advice you could hear, get rid of that. Tell people you've been impacted. Be humble and vulnerable. Tell them how it's impacting you and that you're getting help. Because when you do that, you model for your people the same kind of behavior of being willing to talk about it, number one, which lowers the stigma, and number two, getting help. Because if my senior leader is doing that, well, then I can do that too, without any worry of stigma. So I think it's all about communication and how you present yourself. You don't need to know all the answers. I don't think your workforce expects you to know all the answers, but what they do expect from you is to hear from you in a very authentic, honest way, continually telling people, this is where we are, this is what we don't know, this is where we are, and whether or not we're going to lay people off. Being really open and honest, because it lowers the fear factor for people when they can depend on hearing from you regularly and they're getting updates. Even if there's nothing new to report, that's information, right?
Yeah.
I'm up here in New York, so Governor Cuomo obviously also has been like the Prime Minister in New Zealand. I mean, he's been tearful, he's been impacted, he has family members who have been sick. He sort of tells it like it is, even when it's kind of hard news, but he shows his caring. So, and that's on a huge level that these people like the New Zealand Prime Minister and the Governor of New York can communicate that. So I think individual leaders can too.
It's interesting that you mentioned Governor Cuomo because he has become my new kind of leadership crush, if there's such a thing. Just to watch him lead those daily briefings, I think he's been masterful at balancing the need for facts and information, which can be a stabilizing force for people, and showing care and concern and saying when he doesn't know, you know what, we don't know. He always follows by saying, we're gonna figure it out. And I think that's really assuring for people. And I just appreciate your responses with respect to leaders. Let's talk a little bit about what HR can do. And so how can HR create space for employees to process grief and loss and uncertainty on their own timelines without necessarily crippling the organization's productivity? Do you have any advice for HR leaders and how they can demonstrate emotional intelligence, not be the police necessarily, the policy police right now? That's not what folks are looking for, but to show their own emotional intelligence. What should HR folks do to influence leadership and to create space for employees to process loss on their own timeline?
Well, I mean, I think that's a great question. I think we're innovating also because everybody is remote working, or most everybody is. And so figuring this out of what are the ways to kind of check in that don't feel too much for people, and how do we over communicate but not be intrusive. One of the things I hear is that most workers are working more than they would at work, and they're having to set boundaries with themselves about not working because now they're working from their kitchen table, their dining room, and their kids are there. And so I think there's a concept in psychology and evolutionary biology about social loafing and cheating. But the reality is that most people are not the social loafers, the people who are letting other people carry the load. I don't know what the exact data is, if it's 10% or 5%, but the reality is most of your workers are working really hard for, the team, the business, the mission, the purpose. And so we need to trust them that they can. One thing in terms of emotional intelligence is to trust that people are getting their work done. If they have to online school and then they make dinner and then they go back and finish a little work after dinner, having that kind of trust in your people and that flexibility for people. And I'm hoping that will be one of the things we carry forward, which you might get to that later, so I should hold off. But, is to really carry forward that people could be working remotely very, very well. And so that kind of trust is one thing. Let's give Lisa a chance here.
I think a really important question that leadership and HR, and particularly those midline managers, need to ask themselves and be very honest about it, is that, are we an additional stressor on our workforce? Are we creating additional unnecessary stress in our workforce? And I'm seeing memos and hearing about email communication where there's this very punitive approach to their workforce of, this is not a time for goofing off. This is not, as Christine says, loafing. We're watching you. We're watching your keystrokes. That's somebody in a leadership position who is feeling out of control and very frightened, and is conducting a very obedience-driven style of leadership, which fails miserably in the middle of a crisis and doesn't do really well, but not in a crisis. But to the larger question you ask about helping people, as you say, process the loss and grief that they're going through, again, this is why I believe that education about death and loss and grief in the workplace is mission critical. When we present it as education and not as group counseling or, a support group, people will take in this information, and what resonates with them, they'll have a think about on their own time and maybe talk with their families about. But it's going through all of the myths about grief and loss. And we don't use the 5 stages of grief any longer from Elizabeth Kubler-Ross. We left that behind a long time ago. She was very helpful in the 1960s. But by the way, that was not about bereavement. That was about working with terminally ill patients. Her work was really misappropriated, and she wasn't real thrilled about that. But to talk about the myths about grief and grieving and the suffering contests that Christine talked about before, to provide basic information about what grief looks like, what trauma looks like, how it affects us, how it affects our brain. Right. I think that portal of information and education is how you're going to be most helpful with employees on this issue.
Right. Excellent. Did you want to add to that, Christine?
Sure. I would just say that one of the handouts that I know I provided, it's just, there's so many research-based, strategies for building our resilience. And our resilience is kind of like, either you could look at it as a set of tools, and we have our own favorite tools. Psychologist Abraham Maslow said that if every only tool you have is a hammer, everything looks like a nail. So you need to have a lot of tools in your tool basket for coping, and we all cope differently. So some of us have our favorite go-to, but it wouldn't hurt to expand our arsenal of tools, having more tools in the toolbox, increase our resilience, our muscles, our resilience muscles. But, like Lisa said, that's one of the reasons I switched. Not that I really have the greatest respect for mental health treatment, and I did it for many, many years, but I think the coaching model, is an educational model. So I often will talk about, I'll use words like cognitive behavior training. We all have some post-traumatic stress symptoms. That doesn't mean we are going to all have a disorder. So normalizing that, educating people like that. And one of the handouts I gave just gave a few of those strategies that we could, with some resources, people could look up to go deeper, in terms of building. It takes practice. I'm a big fan of practice. We just don't, it's like kids on the soccer field or basketball playing when they're little. They get better with practice, but we don't teach. I don't think we teach. I don't know. I'd be curious about Lisa's thoughts about this, but we really don't teach people a lot in schools and in our society about how to cope with normal, and this is an abnormal time, but with very difficult things like grief and loss.
Yeah, I would agree. I think one of the things that you mentioned, Lisa, was there are organizations that are watching your keystrokes. What advice do you have for talent management professionals and HR leaders in organizations where that's kind of the MO of the leadership team, is to not work from a place of trust? How do you navigate through the issues of grief and loss and workplace depression while coping with leaders who are not trust-based and who are kind of looming over and watching their staff? What advice do you have for those folks?
When I work with leaders after, a traumatic event that has really disrupted the workplace, and I see them go into that fear-based mode and they're imposing that on everyone else, I remind them that everything you do and say whilst a crisis is going on, and by the way, we're still in crisis mode. And this is not a discrete crisis. Like an active shooting is a discrete crisis, and when it's over, you go into recovery. This crisis is still unfolding. We're not in the recovery mode yet. Everything you do and say during the crisis is already creating and impacting your aftermath simultaneously. People don't forget about being on the receiving end of you, particularly in a crisis situation. What kind of workforce do you want to have? Do you even want to have a workforce when it's time to pick your company up off its knees? Unless you feel that you can do all the work by yourself, you're going to need these people. And are they going to want to work for you and with you? Because everyone is having to think about that right now. They're watching you, they're listening to you, and they're asking themselves, do I want to keep working for this person and in this environment when this is over? And the notion that, well, people are going to be just so grateful to have their jobs, no one's going to leave. I suggest you rethink that, right? Because people are going through a real perspective shift. So if you think that this is the way to get short-term results from your people, you need to think about how you're going to work with the long-term consequences of that, because crisis is temporary, but aftermath is permanent.
No, I couldn't have said that better. I think as an added step, be concerned about the people who actually don't leave your organization, but stay and disconnect, right? Or worse so, stay and become a negative social ambassador for your organization. Get on social media, go public with their statements about how poorly they were treated during this time of crisis. No one wants to be navigating a PR nightmare during this time of crisis. Look what's happened with Shake Shack and Sweetgreen and some of these other brands that were caught with their hands in the PPP cookie jar. Do you want to be the employer who who's, the word on the street about you is that you were mistreating or insensitive to the needs of your staff during this pandemic. Probably the last thing that you want as an organization. And so as a CEO, my advice to other CEOs is think about this not only from just a humanity perspective, which is critically important, but think about it from a business and reputational management perspective. What are you going to do if your name shows up in the paper or shows up on social media as the employer who mistreated their staff at this particular time?
Right.
Not what most folks want. All right.
I would just say, Lisa, real quick on that point, one of the other areas I do some work in is talking about ethical leadership and looking at ethical organizations. And I would say this is a component showing caring and trust in your people is a part of ethical organizations and ethical leadership. And all the research suggests that you're exactly right, that you're at much less risk for having some kind of reputational damage, and that highly ethical organizations are more profitable, more successful, and all the research supports that.
Exactly.
You have been listening to The Switch, a nonprofit HR podcast on powering your people with talent management insights, best practices, and hacks. Looking for a thought partner to help you integrate talent into your mission strategic plan? Well, the good news is Nonprofit HR has solutions to meet your unique talent management needs. Strategic planning is an annual ritual for many nonprofits, yet countless organizations plan for programs and fundraising without thinking about the talent needed to meet those goals and ultimately their mission. With more than 20 years of expertise under our belt and the bench strength of credentialed consultants, we partner with all mission types and offer solutions that span project-based human resources, consulting, and outsourcing, search, total rewards, and DEI. Join the community of social impact organizations that have trusted nonprofit HR to help them achieve their full potential through their people.
So we want to get to some questions because this is a very unique kind of conversation we're having today. So we want to afford a lot of time for questions. But with our closing question, and I'd like to ask both of you, where do you see workforces moving toward as we come out of this crisis? We know that Georgia opened back up for business on Friday, albeit controversially. As the numbers start to the curve starts to flatten and the death rate starts to level off, more and more states are going to consider reopening. And so what do you see workplace moving toward as we come out of this crisis, and how will expectations of both employers and employees change with respect to the management of grief, trauma, and emotional health in the workplace? Christine, let's start with you.
Well, I would just say that, we're in like Lisa's saying, this crisis is ongoing. It's not a discrete thing like active shooting or even something like a natural disaster like Hurricane Sandy, created all this tremendous disruption in New York City. I'm in upstate New York, but was very connected to that. So I think the mental health and the grief and trauma part of this crisis is only, just in its really beginning part. And once, if there is a time when we have a vaccine, when the numbers go way down, when there's much less physical risk, I'm very concerned about another wave, if you will, of mental health distress and vulnerability. And we could think about vulnerability that same way that you think about vulnerability to virus. We talk about some people being more vulnerable based on underlying conditions or their age or various things. Some people are more vulnerable in this kind of overwhelming stress that we're under right now to having a greater impact. So I think when we go back, people will have to be looking for, and especially maybe then Lisa A, that we will have more, opportunities to make those warm handoffs for people that really need counseling. One thing, I'll just make a quick plug. I'm not doing telemental health or telecounseling now, but the insurance companies, to their credit, have greatly relaxed HIPAA restrictions. They're paying providers. It used to be providers would have to, fight tooth and nail if they weren't in a rural area. They couldn't see their patient who might be homebound or not be able to leave the house. They could not get authorization to see people. But now telemental health, I think, is going to be here to stay. So there should be much greater access to mental health services in addition to the educational things that employers can provide. I want to say one more thing about that new quote unquote what's going to come. Just even in terms of this trust issue with working remotely, there's a lot of companies and organizations who can't recruit because someone doesn't live close to them. I work with some smaller credit unions who do wonderful work, but they have trouble recruiting and retaining talent. But if there were more trust that people could work remotely for at least part of their job or completely, I think it would also serve organizations. And so that may be one positive that comes out.
Let me just add, because we do have a number of direct care organizations on today's call. These are organizations that are based in the community, that are community facing, for whom teleworking or virtual work does not fit the business model, right? They're delivering services in and for the community. Lisa, what advice do you have for those organizations as they emerge from this crisis? They've been in the trenches all along. Is there anything they should be doing differently in that their staff didn't get to kind of be home and think through this? They've continued to deliver services in their organizations to the community throughout the crisis. What advice do you have for them?
I would say to leadership that they need to be extremely cognizant of the fact that these people have been operating on your behalf under a chronic diet of fear. They've been out there being exposed. And I think the issue of fear is going to be a major challenge for every leader in this country, regardless of what kind of company you have, because we do not have adequate testing and contact tracing. There is really nothing that leaders have that can guarantee and assure complete safety from being infected when you come back. Taking people's temperature I liken it to what we see when we go to the airport in terms of security. A lot of it is theater. We know that this virus, I think the CDC just came out saying that they're augmenting their infection rate to 25% more, which is a gobsmacking number for all of the asymptomatic cases. And because you can shed virus when you're asymptomatic, people are taking a risk coming back to work unless you have that testing and contact tracing. So leaders are going to be faced with some difficult situations. People who say, I cannot come back into this environment because I'm caring for elderly parents and they're at risk. Or I have an immunosuppressed child that I'm the primary caretaker of. I can't put her at risk. Leaders are going to have to think about how to work with that fear and how to accommodate their employees because we don't have this testing tool, and to think very carefully before disengaging someone from the company because they don't feel safe coming back to work. That's going to be a hard one. So this is a time where we're going to need to be creative. We're going to need to be patient because, again, this is all short term. We will at some point get beyond this, but what you do in the short term will impact you long term. So I think every company is going to have to figure out how to accommodate that very real fear and very real risk, because everyone's on a different risk spectrum for their employees, and to rise above the goal of revenue making. What is your company's purpose? Making money.
Well, we know, Lisa, that nonprofits are not so much focused on the revenue goal. It's not about shareholder value as much as it is the social investment.
What I'm saying to leaders now is, what is your legacy through this going to be? How are you flexing to meet this? What is this situation asking of me right now? And leaders have to become comfortable working with uncertainty, being very present in the moment and making decisions for right now, because that's all we know, and constantly asking themselves, what does this person, what does this situation, what is it asking of me, and how do I need to show up for that?
Great. We want to thank Christine and Lisa for their expertise, their time, and their knowledge. participant interaction is really important for us at Nonprofit HR. And so I do want to be sure that participants get from this experience what they came for. So please, let's open it up to any questions that we have so we can hear from Christine and Lisa some more.
Thank you all. There definitely are a lot of great questions, but there were a number of questions because you spoke early on about recognizing how your employees are feeling. And so people were asking just how do you really do that in a remote environment without offending somebody or kind of invading their privacy or making them feel overwhelmed? So how does a manager or HR person or a leader do that?
I think, again, this issue of role modeling is really important. So like if you're having a virtual team meeting for the team leader, again, there's a distinction between, leaning on other people, your team for help versus being willing to be authentic and open and vulnerable. So go first. If you expect or want to know how your team members are doing, then sharing how you're doing and some real life examples of how you're being impacted and, so that you normalize that fear and you role model that it's okay to talk about it. I do think that one size does not fit all. And some of us, even in normal times, are extroverts and introverts. Some people are going to be, there's this whole performative part of being on Zoom or in a virtual meeting where you see yourself in some way, even if you minimize it. So some people are not going to be as comfortable in that format, but I think it's okay for the team leader to share a bit and then invite others to share. People get benefit from other people sharing, even if they're not willing to share themselves. And then, of course, in individual context, some people are more comfortable. Email gets, vilified all the time, but some people are more comfortable in writing. And so you, as Lisa was saying earlier, Lisa D, your people. If you have an introverted person, I know some people that I work with much prefer writing something to me in email. So if you ask, how are you doing? You encourage people to be open, but you don't pry, you don't push, you're not intrusive, you're respectful, but there's nothing wrong with asking. And then again, like you were saying, Lisa A, having some resources, if you get people, might be deer in the headlights, oh my gosh, I found out more than I thought, and now I don't know what to do. So if you have some of these resources that we've been talking about for managers of where you can help people turn, either for both education and or for treatment, because there is a lot of virtual treatment available now.
You're listening to The Switch. Follow along with this podcast. Download the slides and other visual materials at nonprofithr.com/The Switch.
Great. Let's go to the next question. Lisa, we'll have you tackle that one.
Yeah, there were a couple people asked about cultural differences in your organization. So as you're trying to deal with all of these situations with your employees, if you have an organization made up of people from various cultures, or even if you have a more global organization, how do you deal with things such as bereavement issues or offering condolences or just tackling all these when everybody comes from a different background?
Yeah, that's a really good question. And that's something that I've dealt with for 2 decades in terms of the healthcare sector that I worked in. That's a high mortality sector. And, working with people from all over the world with life and death issues, you have to become conversant pretty darn quick in the culture that they're from, because the key here is that you don't make people step into your cultural experience. You have to step into where they are. Working with people in Crisis 101, start with where your identified client is and move forward when they will allow you. So that means you have to go into their cultural background and work from within that context, because that's where they are. So finding out from a very reliable resource how cultures within your company deal with death, deal with sickness, deal with bad news, deal with talking about death, and also asking those people to educate you. You can even make this an educational kind of activity in, celebrating the fact that you're a very diverse company, and it would be helpful to me as a leader and maybe to your colleagues to understand from your culture, what do people do in these certain circumstances? And also starting a conversation with, I've noticed thus and such with you lately, and I'm concerned. What can you tell me about that? start really simple, right? And right now, the thing that I'm saying to leadership a lot is keep it simple, show up and serve. If there was ever a time for you to embrace the principles of servant leadership, it's now. You are there to serve your people in guiding them through a terrible storm that everyone is afraid, including yourself. They don't expect you have all the answers, but they expect that you have the leadership skills to move forward and guide them through uncertainty. And being real, I think, is the way to stay connected with your people, and they will follow you voluntarily.
I think it's also important to underscore the fact that not having a diverse work environment is not just about kind of celebrating racial or gender differences, but at a time like this, it underscores the importance of diversity, equity, and inclusion in the workplace. And so, if this is your on-ramp, so be it. If your on-ramp was, through a lawsuit, so be it. But use this opportunity to study, as you said, Lisa, from reliable sources and to get up to speed, but also consider giving the people in your organization who have diverse backgrounds voice around this to help you through it, right? And that requires a measure of vulnerability as a leader to say, I really don't know how to deal with this particular community as it grieves or as it experiences trauma. Can you help to inform me? Can you share some perspectives with me? I think sometimes we're afraid to show our vulnerability as leaders and to demonstrate that we don't know. So just wanted to add that. Alicia, let's take a couple more questions.
Yeah, so a couple people asked about what is needed to help employees who are afraid to return to work. Maybe once, for instance, a governor permits people to reopen works. What would you need to do to help address staff fears in those situations?
So I'll tackle this from the HR perspective. Obviously, there are some kind of safety and security concerns separate from the emotional piece, which I'll have Christine and Lisa Dinhofer respond to. But there are guidelines being prepared even now, right, for how you return to work and ensure that your workplace is safe, including things like physical distancing, Christine, in the workplace, making sure that if you have employees in close physical quarters, that you reconsider your physical space as part of a return to work. You'll also want to look at your policies. And it may be now is the time to relax some of those policies around sick leave, annual leave, bereavement leave. Be sure that you educate your staff around employee assistance. Those are some of the kind of logistical, easier to tackle resources that you'll want to consider as you move forward. I'll turn to Christine to answer the emotional component and how to ready staff for that.
Well, I'll just respond to what you're saying, Lisa Alexander, Lisa A, that, some people I work with, leaders I work with at, like even a large university that did exactly what you're saying. They've relaxed their sick vacation policies. So people, if they need to be out, because they got to self-quarantine or because they're homeschooling, they don't have to use vacation or sick time for that. And that's tremendously reassuring. That's a very practical way. Lisa and I have been talking about ways that employers show that they care about you and care about your safety rather than, just the mission or purpose of the organization or bottom line. So I think that is helpful in terms of feeling reassured. I think, again, it really gets at different, people are different in terms of anxiety and what I need to feel safe versus what someone else needs to be safe. So I think, again, to Lisa D's point around flexibility too, one size doesn't fit all. So how would you be able to still have a policy but still make some individual differences if some people feel more anxious than others? I'll just say a little quick story. My daughter is teaching English abroad in Japan. She's 23, and to her amazing credit, she negotiated with the British company that hired her as an assistant language teacher to go in on the train half an hour later and leave half an hour later on the one day she's working from home, but she's got to hand deliver materials because they don't have the technology to like email it. I don't understand that. But at any rate, so my 23-year-old negotiated being able to go in at a different time so that she doesn't have to travel on the busy train. So I think, and her employer, to the employer's credit, let her do that. So that'd just be a simple example of reassuring people.
Thanks, Christine. Lisa, anything you want to add to that?
I think, Christine's story illustrates, the value of being creative. And to the core, this is a time when leadership needs to ask themselves, what are my values? And to be leading from those values rather than leading from policies. You created policies, you can uncreate policies. So what are my values? And what are these company values? And is it valuable to us to maintain our connection and our relationship to this employee? Does their talent matter to us? If the answer is yes, their talent matters, and maintaining relationships with your employees matters, then through that lens, you'll find a way, whether it's allowing people to go on a train half hour, off peak hours, or remaining at home and contributing. It's not about getting hung up on we have to treat everybody the same to be fair, because that's a false concept to begin with. But what do we need to do to keep our key talent wanting to work for us and contributing to us so we can survive?
Great, thank you. Alicia?
Yes, there were also a couple of questions. I believe earlier you mentioned adjusting your bereavement policies. So there were a couple of questions about just clarifying what you might do differently in those policies.
The first place I would start is asking people how it's been working for them so far, because there's a wealth of information there from people who have used that bereavement policy. They can tell you whether it's really working or not. They can tell you what was done to help them reintegrate when they came back, if anything. And that's something that I work with companies on, because they forget about that. They forget about how best to reintegrate somebody coming back to the workplace from a bereavement leave. Asking people, was this helpful to you, or did it make this harder for you? When you came back, were you really productive? We know that grief in the workplace is a $75 billion problem a year for companies. And I'm going to repeat that number, $75 billion a year problem for companies. Most often it's because people are coming back and they're being expected to jump right into things they're not ready. Their concentration suffers, their ability to take in new information suffers, their ability to make decisions that involve money suffer. So it becomes an expensive problem rather than having a policy that really works for what this person endured, what they need at that time, what they need coming back. So it really is turning probably your bereavement policy, the way it was written in standard, upside down and really starting from scratch, but this time with the notion that it is there to serve the employee. In the UK, bereavement leave is called compassion leave. And I love that, because that really reminds everybody what this is supposed to be about. Words matter, right?
Yeah, excellent. Thank you. I like that. A simple name change could just set such a different tone. About 2 or 3 weeks ago, we hosted a webinar on keeping your people together. And a lot of the focus of that session was around values and using your values at a time like this to really anchor your staff and to convey to them a strong message of care. So thanks for reinforcing that without even knowing. We appreciate that. Alicia, what's the next question?
So there were a few questions about, you talked about dealing with people as a group and how do they structure those types of group sessions, and maybe some resources for doing those types of things. So maybe this is for Lisa or Christine. Some of those things you recommended if you were to get your employees together after during a period such as this, or after any kind of grief issue or anything. How would you go about structuring such a session, and where might you do this? Does that make sense?
So if this was creating community around a death of an employee or a debriefing, it depends on what the gathering is for, right? If it's to do a weekly check-in on how are we doing, that's going to be structured differently than a gathering to create community around the death of a coworker. So first you have to be very clear on why are we getting together. I'm a big fan of the weekly check-in meetings where you're meeting to check in with each other and talk about things other than work, right? Just to create social capital. And the more social capital that exists in your company, the better you're going to come out of this and the better community you can create. If it's a debriefing, again, I would start with a cohort that is immediate to the employee that died, maybe the unit or the department that they were in. And then I would go outwards more into a larger cohort. And you have some somebody that facilitates a conversation, sponsors a conversation that they're not necessarily able to have themselves, that also involves education about grief and loss and responses to that, and allow it to be an organic discussion, and just keep going out further from that employee into other groups that are impacted. And they're not all going to be necessarily sponsored the same way, the conversation, because they're impacted differently.
Great.
And
Thank you
again,
so
it might
much,
be
Christine.
better when we go back to work. I mean, when people are in, if that immediate cohort is co-located and you can do it in person at some point, but doing it virtually, I think that's one of the things about I was in a virtual town hall yesterday for the New York State Psychological Association. And we have, in fact, one of the little boards that I'm on as part of the New York State Psychological Association, I'm part of the whole organization, but I'm on an organization consulting and work division board. Out of our 9 members, we have lost one's on a ventilator, and a third woman who's young has been home recovering for 6 weeks, and her husband is doing everything. And so we were doing a moment of silence as a whole organization because we've lost more people. There were 56 people on that call. So how do you make space for that acknowledgement of the loss to our community?
Well, that's our show for today. Thank you for listening in to The Switch, featuring your social impact talent advisors, better known as SETA. If your organization needs to talk with someone about the topics we covered today, please reach out to SETA by Nonprofit HR, your thought partner, a global talent management program exclusively designed to support the people needs of your social enterprise. Together, our brand ecosystem has served the social sector for more than 20 years. I look forward to your call, 202-644-7423, or email us for a mini consult, info@nonprofithr.com. Looking for more episodes of The Switch? Visit nonprofithr.com/The Switch and access recordings and resources to help your organization maximize its greatest asset, your talent.